When we were in clinical, like third and fourth year, they should have had it where like your assistant doesn't show up, right? And they should have put you through like real world scenarios. So and so is angry because their paycheck didn't come in time, right? Or,
like, they're complaining about this. You got like hecklers like just around you as you're prepping, and then like a crying kid, and like a mom just over top your shoulder. You know, like all the things.
We just found out that Laura, who we have coming on right now, is also from Denver like us, which is pretty cool.
That's really cool.
And I think we were kind of drawn at first when we were like, oh yeah, who else should we get on the podcast? Like, she's had that group for a while now on Facebook that's like all dental side gigs. And we were like, oh, we like side gigs. So that's kind of cool. So we figured it'd be fun just to bring Laura on just to kind of talk.
Well, yeah, because it was like after we kind of like stopped clinical dentistry a little bit, and I'm like, you know, searching on groups, I'm like, oh, there's one that's like dental side gigs. I'm like, are these my people? Yeah. Like, is this what I need to like go into? And so joined the group and stuff like that, and been following, you know, what Laura's been talking about. So, so welcome.
So, thanks for coming on.
Thanks so much for having me.
So Laura, so you were, like we said, you're not from, are you from Denver or not? Or how long have you been out here for?
I moved here in 2001.
Oh, yeah, so you've been here
so
a while.
I've been here for a while, but that just means I'm old. I'm not from here though. You know, I'm from Indiana originally and moved around a bunch, but this is a good spot to stop.
Yeah.
We like it.
Yeah. So did you come out here and practice right after you were done with dental school and everything? Oh,
yep.
Nice.
I sure did.
Wow.
Started in a few months before 9/11, actually.
Oh, wow. That's crazy.
Wow.
So what, okay, so how long, I figure we could just get straight into it with you, because I know a little bit about your background, right? Like you had practiced, I believe, tell me if I'm wrong, it was like around 10 years maybe, clinically? Wet-fingered or whatever the weird term we all use for it now, right?
That is a weird
I know.
It's kind of gross.
I don't want wet fingers.
I wonder
Thank
who
you.
invented that. It had to have been some like creepy old dentist.
That didn't use gloves.
That didn't
and was,
use gloves,
yeah,
so his
and it was
finger
like,
was
I have
actually
wet.
wet,
Yeah,
right?
it
That
should
had to have
call
been
like
it.
spit fingers or something.
So when you worked in Denver, did you and worked clinically, did you have your own practice too, or were you an associate the whole time, or kind of what was your background?
I never owned a practice. I was an associate all 10 years. I worked in a range of, they were all private practices, but they were all kind of different. The first practice was a very high insurance practice. So I was seeing 30 patients a day, and it was crazy. And then everybody told me to spend more time with patients and I'll be so much happier. And, you know, in that first practice, I thought I was going to get sued every day because you didn't have time to really take care of your patients the way you wanted to from a relationship standpoint. And then I went to the private practice that was no insurance, and then went to a practice that was a Panky style practice. And so I've seen a lot of different private practice styles, but never wanted to own.
Wow, cool.
So then when did you have, because you said 10 years and you're like, is this something like, was it an abrupt decision? Like after, like on your 10-year anniversary, you were like, I'm done now. I need to reflect. Or is this something that like, did you kind of know, if you can look back on it, like even when you were in dental school and stuff, was this something that like you were hoping was going to be a passion? It was a passion at some point, or you were just like, you know, this seems like an okay like gig, right? I get to help patients, make good money.
I love that question because can you guess, as dentists, do we ever do anything abruptly?
No.
Not really.
It's just not in our nature, is it? No. You know, it's interesting, Eric, that you say that, because I always had this dream of my life. So before I went into dental school, I always had this vision of, I'm going to change careers after 10 years. That'd be so cool. Huh. There was something exciting about that to me, that I didn't want to always do the same thing.
Yeah, you were like a millennial before a millennial was, right? You're like this,
right? I'm always ahead of my time, I guess. But be careful what you wish for, because it was not the excitement that I thought it would be. because we get so tied to our identity as dentists, and the culture of dentistry tells us that we have to own a practice or we have to build the $1 million practice. Like there's a way you have to do it in order to be successful.
Yeah.
And if you don't do that, you feel like a failure. So I didn't actually remember that I had this vision always of changing careers after 10 years until I was going through it. And I was like, wait a minute, this is kind of weird. You've always pictured this and now it's happening. But it was painful. It was not fun. It was not abrupt. It was year 3, I realized that I really wasn't enjoying myself, and life's too short to not enjoy yourself. Like life's too short to suffer through every day. Doing the thing you're doing is taking up most of your waking hours. So it was actually a very painful process when it came down to it. And it then took me 7 years to say, all right, you're going to allow yourself to change. And it was just a long, and by the way, this was, I left in 2011. Nobody was talking about this kind of thing then because we didn't have Facebook groups and we didn't have really podcasts. It just wasn't a thing. I blogged actually.
Oh, wow. Yeah, you're right. We were all kind of isolated and we didn't know what anyone else was doing. So, yeah.
Exactly.
Yeah, geez. So then, since I'm assuming, right, with having your Facebook group and talking to a lot of dentists who probably either feel the same way or in that kind of similar scenario, what have you seen it boil down to on why, what are the reasons dentists tend to want to kind of get out? Because I do think it's a little bit more of a trend, right? Even like us, I guess we're kind of a stereotype of it is we are not fitting the mold of you graduate dental school, you're going to open up a shingle and you're going to work for 30 years and then you retire at 65 and you've been clinical that whole time. Similar to you, we were kind of in that same boat of oh yeah, I always saw myself doing several things. I think when we had Paul Goodman on, right, he used the term mentally flexible, and I'm oh yeah, that's definitely how I am. I could do 50 different things in my life and enjoy it, right? I don't have that personality where I want to do the same thing the whole time. So what are you finding? Is this something you think's always happened and now people just have a chance to talk about it, or what are the main reasons that dentists want to get out?
Oh, that's pretty cool to think about. I do think that dentistry has changed. I hear a lot of people say that after COVID, people are different. The patients treat us differently. They feel like the team members are different. So there could be this cultural shift overall that's making dentistry in some ways harder than it used to be. But I also think that like we just said, we were all isolated. So nobody really knew that anyone else was having inklings of wanting to change. Yeah. And I think you could be motivated by interest and excitement and that mental flexibility. And one of the things we've discovered in my small coaching community is this term called multi-potentialite.
Oh,
have you guys heard that?
No, but it sounds
go
interesting.
Into that.
Yeah, go ahead.
Yeah, I was thinking about that when you guys were telling me about all the interests that you have and the side gigs that you're doing and different things. Is multi-potentialite is somebody who has a lot of different interests and doesn't want to be boxed into one thing. And I have a longtime client who brought this term to me, and she was doing research and she was like, I'm a multi-potentialite. And this is why dentistry creates so much pain for me, because it's so the same all the time. People always talk about the 4 walls. I'm stuck in these 4 walls. I can't go beyond it. And if you are somebody who has a lot of interest and really wants to feed that curiosity and excitement, it's hard to do that in a very conventional dental career. And so what was cool about her, for example, is she discovered that it's okay to like a lot of different things and there's nothing wrong with that. And so since she's given herself permission to explore and do a lot of different things, she's really being more who she is. And I think that's a big challenge, is when we don't get to be who we are.
Yeah. So is that an actual term? Because at first it sounded like a Paul Goodman term where it was like a made up one he did that has something with it, which they work, but is that actually is that actually a real term?
It is, and I just have to side note say, when we were talking about wet finger dentistry, I was thinking about Paul, because he probably has something to say about that term.
Yeah, I'm sure.
But yeah, no, it is a real term. She found it somewhere, and it just opened everything up for her, right? So if you're stifling that in yourself, it could create a pain, and if you allow that in yourself, it could create a desire to want to change, either out of dentistry clinical completely or add more things that could be that you asked earlier, like what is behind this change, right? And so your change could be like you guys wanting to just do more. And I would put Paul in that category too. It's like, I just want to do more. There are certain dentists that they like dentistry, they're happy with it, and there's more. And then there are others who it creates a lot of pain for them. And we could talk all about that if you guys want, but then then we're getting into burnout or really not liking this work.
I think, okay, so to go on that, and I think there's a little bit, I don't know, this is just my opinion, but I think when people are like, I don't like dentistry, right? Everyone just says it's from burnout, right? You've got like new coaches every day saying like, I'll help you with burnout. I'll help you with burnout, right? And I think it's getting like, it's kind of like how the word AI is getting used right now. It's like a little bit overkill, I think. Mm-hmm. And so it's cool to see that like there can be other reasons too, because I almost felt that way too. When I said I didn't want to do clinical as much anymore, I felt like I had to say I was burned out, and I had to come up with an excuse for saying why I was burned out. Like that, I felt like that was the only possible reason there was. So can you go into that, not how it's just not potentially burnout, and kind of what you were talking about a little bit more?
You keep bringing up the best points. About a year ago, I wrote an article, and I think my first sentence was, "Are you burnt out on burnout?" Because how sick are we of that word?
Yeah.
Yeah, it just gets
like
used. It's just like
excuse.
such a catchword right now. Yeah.
Yeah, and I think a lot of us are hiding behind it.
I agree.
Exactly. Yeah. Right? That's what you just said. We're hiding behind it. We're using it as an excuse. And for me, what happened was in year 3, 2004, I was like, I hate dentistry. I hate this. And I still couldn't even admit that to myself, because I wanted to make the best of it. And you've invested so much. You don't want to allow yourself to feel that way. And now, as years have passed, I've allowed myself to say, I love dentistry. I just hated clinical. I really did. It created so much pain. And what was interesting was in 2019, right before, I think COVID made burnout kind of a crazy buzzword as well. Right before COVID, I did a presentation on burnout. And when I was researching it, I was like, oh, these are all the signs and symptoms I had when I was in practice. And then the next question was, wow, was I actually just burnt out? And instead I thought I hated my career. So I started thinking a lot about like, what is the difference? And when are we using burnout to hide something else? And then a couple of years later, I became so burnt out in my coaching.
Sure.
I was just like going and never having breaks. And I think it was also because we stopped traveling for a couple of years there, right? When the world was shut down. And I realized I just hadn't stopped for 2 years. And I was crying all the time. Like if I would do a consultation call and I didn't get that client to say yes, I would cry, which wasn't my normal thing. And I was just getting so upset and angry and stressed. And I went out of town. I took my first break in a couple of years, and I came back totally refreshed. Yeah. And I was like, oh, this is what burnout is. Yeah. So it actually answered my question of, 10, however many years ago, when I was feeling burnt out or hated dentistry, which was it? This was the wrong work for me, because I could compare it to when I was coaching and felt burnt out. I could do all of the things they tell you to do to treat your burnout, and it worked. But in dentistry, I actually tried all that stuff without knowing, and it didn't work.
Okay, because does that go into it then? Because, you kind of hear counter arguments on like burnout too, where people are like, some people will follow on like social media who are really successful and stuff like that. They'll be like, don't be a pansy and just push through, right? Like, at what point do you tell people like, oh, like if you have burnout, like too bad, deal with it? Or is it like, now you need to get out? Because I feel like that, like, what's the balance between that, right? Because I feel like sometimes the messaging can be like, you kind of have to have that balance of...
Well, you don't want like one bad day and you're like, I'm burnt out. And it's like, no, you really just had a bad day. You just need to regroup. Or, another thing is, I'm so burnt out and stuff. And it's like, yeah, because you don't have any system in place to make your life easier. Of course, anyone is going to be burnt out in this situation. You don't know how to do this. You don't know how to lead your team. You don't know how to do all this stuff. Yeah, that sounds like really a terrible job too. But so there's like certain things where I think people just say, oh, I'm burnt out, and then just give up.
Well, yeah, you were saying like people hide behind it. So like when you work with like coaching clients, like how do you like differentiate between, okay, just like pull up your big boy pants and continue working versus like, okay, maybe this is something more serious?
Yeah. Well, there's two things with that. The first is you can hear it in what people say. You can hear when people are like, I've tried everything. I hate it. I come home from, people will say to me, I come home from work at night and I'm so drained and depressed. I have to crawl into bed and my husband has to bring me dinner in bed and I can't be with like it's breaking people down. And so the challenges I kind of liken sometimes, if it's not working out, sometimes dentistry can be like an abusive relationship where it's beating you up every day, but you love it so much that you keep forgiving it for beating you up.
Yeah.
Right?
That's it.
Not to dismiss an abusive relationship, but more to say how hard it is.
Yeah.
Right? And so I think it's really about looking in the mirror and being honest with yourself. And the dentists love clinical talk. So I've turned this into a clinical thing. So think about what they always taught us in dentistry is if you want to choose the right treatment plan, you have to find the right diagnosis first, right? That's like number one on the 10 commandments of dentistry. And so just like in dentistry, let's say someone comes in with a sensitive tooth. You're going to diagnose it the best you can. And if you aren't really clear, you're going to start with the lightest treatment first.
Yeah.
Right? And if it doesn't work, so let's say maybe you're going to, maybe there's some small decay or something. You're going to clean it out. You're going to do a filling. But if that decay approaches the nerve, you're going to say, oh, let's do an indirect pulp cap. If it goes into the nerve, you might say, well, let's try a direct pulp cap. And then you might say, well, let's do a root canal, but you're staging it unless it's very obvious, right? So this is not very obvious to people. So what if we looked at your burnout in that small step way and say, all right, what are the easiest treatments for my burnout? Maybe it's getting support in your office, creating the systems that you mentioned, Alex, right? Or taking breaks, going on vacations, things like that. And if those things work, just like the small filling might work for the tooth sensitivity, great. Now you know that I really like my work and it's just...
I like dentistry. Yeah. And it was just like it was more like of an acute thing. It's not some chronic issue, right? Or like it's that you hate your career. Okay. That's a good way to look at it.
Yeah. And so then if you do all those treatments and it doesn't work, and one of my biggest ones I love the most is, this is a good differentiator. By the way, nobody likes coming home from vacations. Do you guys?
No, of course not.
I hate it. Still, I love my life now, and I still don't like it because it's amazing.
Yeah. Oh, yeah.
So nobody likes it. But if we dig deeper and look at the people who go on vacation and they come back feeling refreshed, that's an indicator that you're burnt out. If you go on vacation and you actually come back feeling worse, like you just hate your life, maybe it's time to look in the mirror and see that it's beyond burnout. This is what I mean by we're hiding behind burnout. We're like, I'm burnt out. I don't want to admit that maybe I don't really like this work.
Yeah.
Yeah.
That makes sense. So, I mean, okay. So will you then try to get, like you said, when you're working with someone too, is it like, hey, let's figure out first, is this just something like you had a bad month, right? Production was down. It was September, right? And you didn't like it. And let's see if you actually still like, you enjoy dentistry. And then if you don't, then we kind of move on. Other question I had too is, do you find with clients too, or anyone you work with, is it sometimes just more of a personality trait? Like, meaning if someone's like, I've got burnout, I don't like this, they're going to move on to the next thing. And then they're going to be like, I have burnout, I don't like this. And like the issue is more at their core of who they are. And they're just not, they just don't have like the grit or determination. So it's not that they'll never find what they like, right? Because they don't have that core value of like, I'm going to work really hard. Now I just need to find something I love doing or I enjoy doing, and then I'll be good. If you like our podcast, check out Alex's newsletter, Just 2 Minutes. It's full of great advice, which makes sense considering it's her thoughts and not me sidetracking her every 2 seconds. You can subscribe at coupleofdentists.com. The link is in the show notes. Now, back to the pod.
Absolutely, yeah. So, well, when I years ago worked with a career coach who didn't really understand dentistry, I wanted to find out, could I like this?
Okay.
And I think most dentists want to take that angle.
Yeah.
And, back to your question earlier about how do I know, is like, people will tell me, I want a different career. I want to do something different. I've tried everything. And then when we get into the work, it's very common to get scared.
Yeah.
And then to shrink back and give up that and say, oh, but no, I like dentistry. So I think it's great. I think all of us owe it to ourselves to explore, how can I make this better and how can I do it? It's just, I went to Panky 4 times to try to fix it. That's a big investment.
Yeah. That was probably expensive. Yeah.
Yeah. And it didn't work for me. So that's another way, right? Yeah. So I love helping people explore that if that's what they want. Have you guys ever heard the term uncoachable?
Yeah.
Sure.
Yeah.
Right? Like, people will say, oh, that person's uncoachable.
Yep. Yeah, I feel like in sports you hear that a lot, right? Like, this player's uncoachable, right?
Yeah. So I've found that if people are not aligned, like the outcome they're trying to get doesn't align with their realness and honesty, they become uncoachable. And it's not like they're being jerks. They don't do it on purpose. But it's like the people who are saying, I want a different career, and then they won't allow themselves to pursue that. And they just try to find more fixes within this thing that's not fixable for them because they've tried everything already. They become uncoachable because it's not aligned with what they want. And then they don't do the homework or they don't change themselves.
They almost like want you to do it for them. Or it's like the patient too, right? Like if they come in with unrealistic expectations and you're the dentist, right, in that situation, you almost say like it's an uncoachable patient. Like you can't make them happy, right? Because you're just misaligned. Yeah.
Mm-hmm. Yeah.
You had something to say.
Yeah.
Alex.
No, I didn't.
You were chomping at the bed for a second.
All right. Well, just cut me off if you do. So, but I think a lot of times being uncoachable, we would blame the other person, but it's not always their fault. Like they're trying, they mean well, they want the best, but they're just not listening to themselves. We're so good at dismissing ourselves as dentists because we're just here to serve everyone else. And we forget what it's like to know who we are and listen to what we want. So, and unless you guys wanted to jump in, I'll go into this personality question.
No, let's go. Let's go into that.
Yeah. Yeah.
Okay. So, what you said makes me think of that belief that wherever you go, there you are.
Okay. Yeah.
And a lot of us worry about that. And a lot of people who are unhappy for years, decades in dentistry are afraid that if they change, that they're just going to be miserable in their next thing. And I always say that if you really do it the right way, you have to change from the inside out so much in order to give yourself permission to leave dentistry, for example, that you aren't going to be the same person when you're in that next thing. Now, some people can do that if they're jumping. But I think as dentists, we could probably agree that all of us are hard workers. We're not lazy. And dentistry kind of plays tricks on our minds and makes us think that either we hate people when we actually like people, or we're lazy, or I don't have enough grit or determination. And I think, how could you get into dentistry without any of that?
I mean, you kind of self-select, right?
Yeah.
Like, you had to go to college. You had to get good enough grades to get accepted into dental school, right? You had to get it through dental school. So yeah, that does make sense. Like, based on past experiences, you've probably already checked off those boxes.
Yeah. So so that's just my new, and I think it's easy to say, and I think sometimes we even do that with always the younger generation.
Yeah.
The older generations will be like, oh, they don't have any grit.
Yeah.
And, maybe they do, maybe they don't. How do we know? Every generation seems to do that. But, and that's just an example. So I think that we all have grit. We just don't see it anymore because we expect of ourselves. Dentistry's hard, and we dismiss the amazing things that we all accomplish as just being normal.
Yeah.
Yeah.
Like what? Yeah. Like, if you think about what you're doing, like I've thought about that too. Like, I've talked to some people, like either family members or stuff, and like I may have a day and I don't know, I did a crown prep and I did some fillings, and you do, even if it's just bread and butter dentistry like I do. So nothing like crazy, like placing implants or doing full arch stuff. But if I went to someone that wasn't a dentist or didn't know, and I told them that's what I had to do, like I had to give a patient a shot in their mouth. I had to take a sharp drill in a small area, and their cheek was like 5 millimeters away, and I didn't hit it, right? And I drilled around an entire tooth. I shaved off the top, and you explain what you did. A lot of people would be like, that would like scare the shit out of them to do. They would be like, that is so hard. And I think you're right. Like, we kind of become numb sometimes to like how much we're actually doing. That's a good point. I didn't think about that.
Yeah. And not only that, but we own businesses.
Yeah. Layer that.
Yeah. Practices. And we forget that we do all the things to have a really successful business, but because we call it practices, we don't really see them as businesses, right?
Yeah. So dumb.
So what I think is funny, well, I guess it's more sad, not funny, but the stuff we do as dentists is hard. And I've never seen such a noble, impactful, high-level career that makes more people feel badly about themselves.
Yeah. I know.
It's weird.
Yeah, it is weird. Yeah, I don't know if you see it as much in like, I don't have a ton of friends that are doctors, or I'm not in those communities, or like, I don't know, lawyers, other like professionals like that. I don't know if most of them, because I feel like the general sentiment is like, if you put a poll out on a Facebook group of like, do you like dentistry? Most people are going to be like, screw this, I hate it, right? Like, I don't think
dentists? Or
for dentists. I don't know if that same thing happens in like,
well, because we get told to our faces by our patients, we hate you.
Yeah.
Like, what other profession does someone think it's okay to walk in and say, I hate you? Yeah. And it's like, oh, okay. And like, I'm just getting numb to it. It's like, whatever. Like, good. Well, I probably hate you too. Like, I don't care about that. But other people who want people to like them, like you,
me.
like that probably affects you more.
Oh, yeah.
Yeah,
so, I think that affected me the most. And then like with your team, right, or your staff is, I remember like really early on, I would get really affected if like someone left or they quit, right? And I found out later they didn't like something. And Alex, for some, I don't know, maybe it's just we're wired a little differently. Yeah. You were just like, no, the job is you're their boss. It's a business, right? Like, you're not meant to be their friends, right? They like, you used to be friendly with someone, but there's a big difference between being friendly with someone and like being a friend, right? They just have different expectations. And so I think I came into it more like, oh, I want to be friends with everyone. And then it actually made it worse, because then they don't respect you like a boss, and your role in that position is boss if you're the practice, right, or business owner. And so I feel like I always struggle with that piece, and maybe that's where a lot of my like some of that seeping of like, I don't like doing this, I think came a lot from that as well. And then you kind of just had to become numb to it, and I just had to understand like, look, in this situation, I can still have other friends, but in this situation, I am the boss and the owner of it, and I have to wear a different hat here. And like, if they don't like me, they don't like me. That's okay. But that's not my job. My job is not for them to like me here. It's for them to get a paycheck, have a job they feel like, is steady, that they can work for, that they enjoy coming into work for. But like, I don't need to be their therapist too, right? Like you would be to a good friend.
Yeah. And like, where do they teach that? Like we go through school, like years and years and years, learn how to shave a millimeter off here, do this thing, make sure all the dental stuff, all the clinical stuff, they teach it. And we go through it and we get through Hell Week and we do all that stuff. And then you add the other layer of people.
Yeah.
And that's, I think, where a lot of people are like,
I'm
burnt out. So, and it's like, yeah, I get it, because we have zero training on how to lead people, own a business, run a business, do it successfully, create systems, all of that stuff. No one knows how to do that. And then you're like, this is really hard. And it's like, yeah, it is hard. No one taught us this.
You know what
like, it's supposed to be hard. We have to learn it. You have to get through like all the steps to do it, just like in dental school.
So we should have in dental school, they should have done this. When we were in clinical, like 3rd and 4th year, they should have had it where like your assistant doesn't show up, right? And they should have put you through like real world scenarios. So and so is angry because their paycheck didn't come in time, right? Or,
Like, they're complaining about this.
This other
you got like hecklers, like just around you as you're prepping, and then like a crying kid, and like a mom just over top your shoulder. You know, like all the things. Because like really,
the only thing in dental school that you have to deal with is like patients not showing up, right? But then like you have one patient for the whole morning, so then you just like go to the gym and work out, right? Or you're just like, I'm done for the day early. Like there's really, you know, there isn't like, oh crap, I didn't get like $1,500 production in this, I can't make payroll. That's what it should be. Like, that'd be funny.
Yeah, real world.
I'm seeing a reality show competition.
That would be pretty funny.
I know.
Where you just fabricate.
Oh, you would. Well, that would be like, it would be like Scared Straight, but like dental school edition, right? Like put kids through that, like no one would graduate. They'd all be
they'd be like, I'm out of this, and then it's like, yeah, okay, well then we just saved you a career of like not wanting to do this. It's like, all right, you should probably do that like day one.
Yeah.
Be like, here's like your entrance exam.
Yeah.
Can you handle this?
Yeah.
That would be amazing, because you can't know how dentistry is until you do it. And so imagine if there was like a boot camp.
Yeah. Because
I love this idea.
Yeah. It's like, what's worse? SEAL training? We should ask someone who's been a SEAL. SEAL training or dental school training with that? Yeah. I don't know.
I wonder. Yeah, I wonder.
I wonder too. It's a toss-up. So, and what you guys are saying is brilliant, because this goes back to your personality question. Is there a personality that makes you like it or not? And I would say we could look at it as, we have different personality types, that some of us, based on our personalities, dentistry is easier for us to cope with, and we don't take things as personally. And another way that I look at it is different from saying it's your personality, but similar. It's because personality, like, have you guys ever done a Myers-Briggs or a DISC?
Lots of them.
Yeah. And those are going to say you're an introvert or an extrovert. This is your personality, and that's how you are. It can never change. And I feel like we can box ourselves in.
Yeah.
100%.
We say, well, I'm an introvert, so I don't want to talk to people all day. Right? And we might use that as an excuse or a crutch, right? I look at, and I use an assessment that's similar but different. Instead of being a personality assessment, it's an attitudinal assessment. So instead of saying this is how you are, it's saying this is how you see the world. And I've seen these amazing patterns. Now, my world is very skewed because I'm talking to the dentists who are pretty unhappy. They want change and they feel stuck and they don't know how. But what's cool is they all have the same pattern, and it's at the heart, at the core, we are people pleasers. We want to become friends, like you were saying, Eric. We want to like just give and give and give and show how much we care. And sometimes it's so that we can be trusted and liked by our patients and by our team, so that it will keep us and everybody safe, and we'll get the best results, and we won't have to deal with problems. That's underneath it. But at the end of the day, we're giving so much that it comes at our own self-sacrifice. And it's, instead of saying that that's my personality, I would say that's how I see the world. Is that's what I'm supposed to, hello to your little cool paintings back there. I'm supposed to be the hero for my patients. And that creates so much pressure that we put on ourselves. We end up carrying the weight of the world on our shoulders, all because we have this perspective that we believe this is how it's supposed to be. and it brings us down and makes us feel guilty if we have an uncomfortable conversation. Or let's say you're on call, you can't win, because if you go in, you feel like you shouldn't have had to go in, and so you feel resentful and angry that your patient has taken advantage of you. But if you don't go in, you feel guilty that you didn't take enough care of them, right? And so we create these no-win situations that are on us. It's our attitude. Now, maybe what I'm hearing, Alex, for you is that you've been able to have better boundaries and not take it personally and not do what some of us burnt out dentists have done, and been able to say, it's okay that we're not friends, and it's okay that I don't go, that I draw a boundary, and you're not going to get as bogged down by it. Like I hate the dentist used to just, even though you try to numb it out, it still like chips away at your heart and your soul a little bit every day when you hear that.
Oh yeah, it does. I mean, it's unfortunate. Like my solution to it was to just get more numb to it. Yeah. But I also think too, I had a pedestal put on of like, oh my gosh, if I'm not these people's friends and they don't like me, then they're not going to want to work for me. It's going to be a big issue. And then I found out once I created some more boundaries and I kind of stepped away from like maybe sharing as much, right? Or that kind of stuff. It didn't change anything. They still if anything, maybe they respected me more. Like maybe they also just didn't want to be friends with me either, right? And I think sometimes I don't know if that's like our ego coming in where we assume everyone wants to like us too. But maybe some people just want to go to work and they have their own stuff they're dealing with, and I think sometimes we just assume everyone wants the same things we do, right? And that isn't the case. So like I always felt like I was going to create a bigger issue if I didn't do this, but I think that was me just masking that's something I wanted. And so instead of just saying maybe this wasn't the best for the other person, and that was just maybe more of a selfish thing, I don't know.
Well, this is why I love looking at it as an attitudinal perspective versus a personality, because you're a perfect example of how you shifted and you changed the way you saw things in order to be happier at your work and to have more success at your work. Is you went from feeling like you needed to make sure everybody liked you in order to be successful to then say, I can have boundaries and protect myself so I'm not always sacrificing myself. And that's how you did that. I mean, does that sound like that could be?
Yeah. I mean, I owe that to Alex. That was her. That was her just beating me down a little bit. And like, you should, honestly, it's one of those things I probably should have, like, when you look back, I get there's like a process. And if you're trying to change something, like you said, you just can't like snap your fingers and do it abruptly. But if I could go back and tell my younger self, I think I would say to be okay with that, like earlier on, and not fight it as much or take as long to fight it as much. Cause it, like when I came out on the other side of it, it wasn't like worse.
Yeah. I think that makes sense. I mean, I definitely didn't say it in a nice way, to convince them, but I think that's okay.
Yeah. So,
well,
go ahead.
Okay. But when you see the world as I have to be the hero, I have to be liked by my staff, I have to be, I have to fix everything. And the best way to change two things. One is, a lot of us show up in our careers that way. And then at some point after enough time and experience, we have a choice, is we can go down the two paths. One path is either the path you went down that was like, I'm going to have my boundaries and I'm going to learn to cope with this and make things better. And then that's how you're going to grow and be able to be burned out in dentistry and fix it. Or you could do the path I took, which was like, this is making me see more and more how hard dentistry is, and one of the best. And so I wasn't ever able to fix that like you were. And one of the best ways to change your attitude and your perspective is to have somebody who sees it in the new way. And so that's so cool, because Alex, you were able to be an influence for Eric and help him go down that path.
Oh, it took years.
Yeah.
Yeah, I'm sure.
I wish I could just say it and then it would work, but no, it
we were joking that happens sometimes. We were joking with one of our buddies. He's
Yeah.
like, sometimes you need to hear something from someone you're not as close to, right? And sometimes that helps a little bit more. But going back to like the hero thing, like the biggest thing I think, and I don't know if you ever felt this stress too, Laura, or if other dentists you work with have felt this stress, but and and you don't really as much, Alex, as I do.
Oh,
that's a long-winded way to get into this, but
okay.
So if I was a chef, right, and I was working at a restaurant, and I made someone a meal, and I know what I'm doing, right, because I'm a chef, and the meal comes out, and it's like 6 out of 10, right? It's not that great, and people don't like it that much. Well, guess what? What's the worst that happens? Maybe they're like, I don't like this food, or I don't know, maybe they get a stomach ache for a little bit, right? And then they're fine, right? It's not a big issue. The issue I always had with dentistry was doing something irreversible on someone, and that's where the stress came from. So like, even if it's a filling, the fact that like you can't undo drilling a tooth, right? I know you're still fixing it, right? So you're making it better, but I always had a really hard time convincing myself of that piece and I focused more on the negative. So it's like, I'm drilling on a tooth, I'm breaking something down, I'm putting a filling in. Oh man, if they have issues with this tooth, or I do a crown on a tooth and it needs a root canal, instead of saying I tried fixing this tooth and I tried to make it better, I would reframe it to like, I permanently damaged this, right? And different from being a chef or in any of working at Starbucks, right? Like, hey, I made a shitty latte for you, right? It's like, okay, then I can just remake a new one, right? It's really easy. Like the solution is easy to fix. There's not really an easy solution where you can go back and be like, I'm just going to regrow your tooth back and I'll try again, right? So I think for me, that has always been the most amount of pressure I've felt. And that's what's like, I have not been able to solve well yet.
We all know Eric wants more friends. If you're enjoying this episode, share the podcast and then tell them to DM Eric so he can hit his quota of 1 new friend per day. Now back to the episode.
100%. That was me too. And I think that's a lot of people. And this is so actually these attitudinal perspective shifts, I've been able to really make really well in my life outside of dentistry. And I still, even if I'm helping people within or outside of dentistry, to begin to say, because this is how we see our whole lives. It's like, even when I'm driving in traffic, little things like that, I am behaving in ways that I'm still showing up like, how can I help the other person? Or how can I be considerate to the other person? And we're going to do anything to make sure the other person wins. And how do you, like in dentistry, if something goes wrong with just a filling and you've done the work, the people who feel better in dentistry are able to separate that and say, this is their problem. It's not mine.
Yeah.
I don't have to own it. And for me, it was always hard because I was like, I literally did the work. How do I not own it?
Yeah. Yeah, like you didn't have Alex. No. Alex was able to like cope with that piece better. I think you've always been able to, is like to separate yourself from it.
Yeah, and maybe that's like ego or something, that like I'm trying to fix something for you, so don't blame me. But yeah, I know you've always had an issue with that.
Yeah, that's always I've always struggled with that piece of it, and I understand like at its core, it is. I don't know to say like right or wrong, but I mean, you should focus maybe more on the positive and what you're doing to help someone. But it is hard. It's hard for me to deal with that. But like same thing, Laura, like you were saying earlier, when like you would go on a coaching call, right? And you were saying you felt burnt out on it. And like, if the client didn't want to join you, you thought like, hey, maybe something's wrong with me. But like, guess what? Then you could just like practice, or you could try to call them back in 2 weeks, right? And follow up. Like there's things you can do there. That's the part I always had, is like, I think sometimes my brain goes so logical, I can't find the solution to get out of it, right? Which is like, I can't go back and fix the tooth again. It already happened and there's no way out. Mm-hmm. And I think maybe that's why when I was like a kid, I always had to write in pencil, because I knew I could erase it and I could redo it. Like I hated writing in pen. I hate to this day writing in pen because it's permanent. I mean, I won't get a tattoo, and that's the reason why. Because I know I would be that person that would just sit every night and be like, did I make the right decision? It's like that guy in the good. It's like the guy in The Good Place, right? That like can never make a decision because he constantly is like analyzing every decision. Yeah. I feel like that's what I would do. So maybe that's, to your point, you just have to understand maybe that some of that is like how you're wired a little bit, and instead of trying to spend like 30 years fixing something like that, just learn how to cope with it, and maybe either go into something that doesn't put you into situations like that, and then maybe you will be more successful because
well, I guess it's kind of like you're in that fork in the road, right? It's like you can either figure out what the mindset shift is, how do I think about this differently, or I need to change the environment altogether.
Yeah. And I don't think it's a bad, like I said, like we'll get into like, I want to go into, because you do side gig stuff. So in a second, I want to go over some fun stuff that dentists have done, because I feel like we're going so like, it's becoming another therapy session for me, right? I feel like that's what all these episodes turn into that,
so good.
Right? So like, yeah, I don't know. I feel like what you were saying, Alex, with doing that fork in the road, right? And then if you decide you don't want to do it, I've noticed in dentistry compared to other professions, you do get like, the other word that gets overused all the time is like shamed. Like, I think it's kind of a stupid word, right? But like, I feel like if I went on a Facebook group now and was like, I don't like clinical dentistry, I don't want to do it anymore, I've tried, I don't like it. Oh, I'll get like 6 comments on like, stop being such a pussy, figure it out. Like, you know, you're just not tough, right? And then it kind of like, it makes you not actually want to be transparent or truthful. And those people should just be like, cool, I don't give a shit. You don't want to do it? Do something else. Versus like, you're ruining the profession. This is why you shouldn't, like, you're ruining this like great thing. And it's like, okay, maybe it's great for you, but like, also those people tend to be the ones that are the loudest usually like are the least successful. But I don't know. But I don't know. That is true in dental. I don't like that piece of it. Like, we tend to like not lift each other up as much.
Yeah. And I mean, they have different values. They're going to value, like, I'm going to want to make so much money over my personal happiness. And like, you couldn't at that point have paid me enough money to live the way I was living mentally.
Oh, but even some of those guys too, like I'll have friends, like both of our practices did pretty well. Like they produced a good amount. We have friends who have crushed it. And you'll get a lot of dentists on there who complain that like you're too focused on the business part of it, right? And it's like, well, you know what? Like, your office is probably doing like $500,000 a year. You've had like one assistant forever. You've never hired an associate. Like, you're comfortable in your little bubble. Like, just because that's better for you doesn't mean it's better for me. And like, stop hating on me because that's not what your path is. And I feel like that's what everyone kind of does.
Yeah.
Yeah. Well, I want to say one thing before I move on to this next topic, that wanting to be the hero and really caring about it, that filling goes wrong, it's permanent, that kind of thing, comes from a good place. It just ends up hurting us.
Yeah.
Oh,
yeah. True.
Yeah.
Yeah.
It's good intentions. It's because you care so much. And that doesn't mean that, like, if you have good boundaries, it doesn't mean that that person doesn't care.
Yeah.
Right? Like, Alex, you can care equally as much. You're just putting a different kind of pressure on yourself.
Yeah.
That's it. Right? So, but I have a rule in my Facebook group, and it's hard to enforce, but it's my pet peeve is when someone comes on and is like, this is hard for me, or when people are like, oh, I love dentistry. It's like, that is not helpful to share how much you love it when this person's in pain. Or telling people to buy a practice. I know a lot of dentists who have been suicidal because they've done what everyone said and bought a practice, and it was the wrong fit for them. So if we could just find more customized solutions to what's creating our pain, here comes back to the diagnosis, right? Then we can all do what, I don't care if people stay in dentistry or quit. I just want you to do what you want.
Yeah.
Yeah. I know. It's like, you do you. Like, don't tell me what to do. I won't tell you what to do. Just like, still all just mind our own business.
So when you say do what you do, right? We can segue into this then. Okay. So what are some cool, like, what are a few of like the coolest side gigs you've seen? And let me preface, side gig could also mean like career change, right? So it doesn't just mean like a thing that you do on a Saturday, right? What are some cool things though that dentists have gotten into and you've seen how successful they've been doing it and how much like happier it's made them? So like what are some cool like ones that you've seen?
Yeah, so you want kind of weird, unique.
Weird,
yeah. So, well, my favorite one is my client Jenna, who started a business called Artinis.
Okay, that already has my.
Interesting. Okay.
What is it?
Yeah, and we helped her build this from scratch, and it's a totally new concept in dentistry, but not really a new concept in the outside world. You know those painting and sipping places?
Yeah.
Well, we took that concept and helped her create workshops for dental teams. And she lives in the UK. She's in Wales. And she will host workshops they're like team building workshops where she provides CE credits, and they can have wine or whatever if they want. But she's created these painting exercises that teach communication and leadership and perfectionism or anti-perfectionism. Yeah. And that is so cool because she's an amazing artist and she found a way to monetize and still have fun. And she's cut down from 4 days a week in dentistry to 2.
Oh, that's pretty sweet.
That's
so
awesome.
It's called Art and then Teeny. So like martini without the M.
Correct.
Oh, that's pretty cool.
Nice.
That's actually it's
cool?
a good spin, right? Because
Yeah.
you do see so much now. Like we brought consultants on. Every consultant's on there. It's almost like the playbook's the same, right? On how they do stuff. Like come in for a weekend, teach you stuff, then implement, right? I think it's cool to put a weird spin on that. And it's cool that like she's good at art. I mean, if I did it, it would be terrible. It would like draw a stick figure, right? I couldn't do a good job with that. But that's pretty cool.
Yeah.
So has she found pretty good success on like yeah.
Absolutely. And to be able to do what you love, right? And what she gets to see is that, well, like your point earlier, if someone's tooth hurts, it feels so bad. But if somebody makes a painting that's not so cute, like everything's so much easier than dentistry.
Yes, I know.
True.
So I love the creativity in that, and that it is around something that she loves to do. And people are finding her. So it's very cool. But you want to hear some other ones?
Go through it. Yeah.
Now, these are not people that I know, but I've just found them online that I think are so cool. There's a guy in France who's a Cirque du Soleil clown.
Really?
So dentist turned to Cirque du Soleil clown?
Yep.
Wow. That's pretty sweet. That'd be fun.
I don't know if he's retired, but there was that dentist who became an NFL ref.
Oh, really?
Yeah, there was.
Was there?
Well, a lot of NFL. I found one of our friends in the military, the girl he married, her dad was an NFL rep, but he was an attorney. I've heard a lot of attorneys go in to become referees, which makes sense because it's so like rule heavy, right? So that is one thing that I think could translate well from like a stereotypical dentist. So maybe not like the artist creative type, but the type who's like, I like structure, like the person who likes to do endo, right? Like, I feel like that person could probably be a good like sports ref because it's just very like, this happens, then you do this. But yeah.
Yeah. And there's a good story in that because how he got to that level was he was, I think, volunteering or just doing like high school coaching when he was young in his career and did it because he enjoyed it. And so many of us are like, I'm not going to do this thing because it's not going to pay off. And that's what keeps us closed off and stuck and only being dentistry.
Well, and I think like you said too, like we kind of self-selected. So like, I think we have to have a little more confidence in ourselves too, to say like, look, if you were good enough in high school to get into college, and then if you're good enough in college to get through dental school, and if you were good enough in dental school to get through dental school, right? And even if then you were just practicing for a while, but then if you owned a business and you got good at that, like I think you've shown that you've got the right skill set to be successful. So then if you apply that to something that you're like, I love this and this is just fun, like you'll do a good job. So I don't know.
Yeah.
Absolutely. Yeah. You just have to put yourself, you have to start.
Yeah.
Okay. So there was a guy who, and I can't remember the exact details, but it was like, he went into, chimpanzee or orangutan research and totally left dentistry. And it was somewhere not in the U.S. But I heard of that one a while ago.
And he just went into like another country, just started working on like research on animals, and probably just got to like play with them all the time. That'd probably be fun.
That sounds interesting. Yeah.
Yeah.
Wow.
So I love these rebellious ones. The one that a client of mine who lives in Colorado, is starting to explore is becoming a psilocybin coaching facilitator.
Oh, really?
What is that? What type of?
So there's a lot of new research that magic mushrooms is psilocybin.
Okay.
That when that is used in therapy, that and some other psychedelics, that it is having a profound effect on actually curing things like depression, PTSD, addictions.
Oh, wow. Okay.
So there's this whole thing, and that I love because it's so rebellious.
Yeah.
Like I'm like hoping that he continues to follow through, because I would love to that's the one that I think is like in dentistry. Oh yeah, I know a dentist who became a psilocybin coach and facilitator.
That's pretty crazy.
Mm-hmm.
I mean, I guess
I've heard of
Colorado is
those, yeah.
probably the right state to start it in, right?
Yeah, probably. Yeah.
Right.
Have you?
Yeah, and it's legit a thing.
Yeah.
I mean, I know a woman who's a therapist who's getting her certification in it, and she could not do that if, you know, she couldn't risk her therapy license if.
So then you get so is, just so I understand, so like you get a certificate for it, and then it almost gives you the ability to like prescribe and like help treat someone using that type of medicine, or, you know,
Drug.
You basically do a therapy session with them, but it's not therapy because you're not a therapist, but they call them journeys. So you do like, and sometimes they're hours, like 6-8 hours.
Oh, so it's like that stuff
and
like Aaron Rodgers did, where he like would go to like a tent for like 2 days and just like go on a bunch of psychedelics and go through like a crazy trip, and like
kind of yeah, but more like regimented, like, you know, like,
because in my head I just go back to like, I think of all the people like smoking peyote and doing like Native American kind of stuff. Is that like the concept where it came from, is just doing like putting yourself in an altered state of mind and then just trying to have someone like help you work through stuff while you're in like that state? I know nothing about this.
I mean, yes, so, I think yes, because I listen to podcasts and they're like, yeah, there's this thing like in New York and stuff like that. You go and it's like just like you go to a therapy session, except it's different. Like they're not talking on a couch. I mean, there's probably a couch, but like they give you the drugs or whatever, and I don't know what happens after that. But I guess there's some research out there that could potentially help. I mean, I think it's so early. I don't know if there's like detrimental effects. I have no idea. I know nothing on this topic, but that it is now a thing. Yes.
That's cool.
It is a thing, and it's not like people aren't doing it to party.
Right. Oh, absolutely.
They're doing it with a person who's helping them through. Let's just compare it to, it's kind of like talk therapy when you're under the influence. And
we should totally we should totally get that person on the podcast and talk to them about this. If they'd ever be open to it after this, I'll see if he'll give me their info. That would be so cool, just to learn more about that.
Yeah, I will see. I don't know if this person is ready.
Okay, well, when they're ready, you keep us posted. And they've got a spot.
Because it is. But I think, like, why not? You know, there's just so much out there in the world. Do what you want.
Dentistry is still hard to get into. There's more applicants applying than people getting accepted. And I still would argue there's probably still a lot of good applicants that don't get accepted. So, like, if someone wants to leave, there's going to be someone that can take it over still, right? I don't think we're going to have a shortage from that. Yeah. So I guess that's a good way to leave it. Well, yeah, thanks for coming on. I appreciate it.
Yeah, thanks for having me.